They were told they had bad blood, a vague diagnosis, a simple problem, the kind doctors could fix. They were promised treatment, free checkups, warm meals, burial insurance for their families. What they weren't told was that they had been signed into a death sentence. Tuskegee, Alabama, 1932. The U.S. Public Health Service, with support from the Tuskegee Institute, launched a longitudinal syphilis study. 600 black men were recruited. 399 had syphilis. 201 did not. They were never told which one they were. They weren't asked for consent. They weren't given a diagnosis. They were given hope. And that made them vulnerable. Charlie Pollard was 23 when he joined the study. He was quiet, hardworking, grateful for any help he could get. Each visit, he gave blood, answered questions, took the pills. He shook the doctor's hand. He went home believing he was getting better. He stayed in the study for 40 years, and for 40 years, they never told him the truth. Internally, doctors referred to them as subjects, not patients. One 1933 memo read, "The men do not need to be told they have syphilis. It would introduce doubt." In another, "We must be careful not to contaminate the study window with treatment." Contaminate. They used that word to describe penicillin, the cure. By the 1940s, the world knew how to stop syphilis. Penicillin was fast, effective, life-saving. The World Health Organization was distributing it globally. But in Tuskegee, the medicine was withheld, on purpose. Doctors from the CDC and U.S. military signed off annually to continue the experiment. It became a machine, no longer driven by curiosity, just by inertia. Men started losing their sight, their coordination, their minds. Syphilis attacks the nervous system. It moves slowly, then all at once. Some men became paranoid, others violent. One man died choking on his own blood, thinking he had the flu. The doctors noted it, wrote it down, filed it away, and said nothing. Wives, unaware, contracted the disease. In some cases, they weren't even tested. Their symptoms were dismissed as stress. Children were born infected, babies, blind, deaf, with holes in their spines and failing organs. The study didn't end then, it kept going. Because the goal wasn't to help, it was to record. Because no one was watching, because no one wanted to. Racism wasn't written into the paperwork. It didn't need to be. The silence of institutions was enough. Doctors were promoted, grants were renewed. The men kept dying. In 1972, a government worker named Peter Buxton saw the files. He saw what was happening. He raised concerns internally. He was ignored. So he went to the press. The Washington Star broke the story. Days later, it hit the front page of the New York Times. The country was horrified. The world took notice. The experiment, after 40 years, was shut down. But the damage had already been done. By the end, 128 men were confirmed dead from syphilis or its effects. Dozens of wives were infected. 19 children were born with congenital syphilis, and 0 people went to prison. There were lawsuits, there were settlements, but for most families, there was never closure. In 1997, President Bill Clinton stood before the surviving men and their descendants and said, "What the United States government did was shameful, and I am sorry." 5 survivors sat behind him. Some were blind, others frail. One gripped the hands of his grandchildren during the speech. He nodded slowly, but said nothing. Some wounds go too deep for words. The Tuskegee study didn't just destroy lives, it broke something larger: trust. To this day, medical distrust in Black communities is rooted in this trauma. When someone hesitates in a clinic or avoids a vaccine or questions a diagnosis, Tuskegee is in that hesitation. You won't find Tuskegee in most history books. You won't hear it in classrooms. But its legacy is there, in health gaps, in buried records, in silence passed down through families. This wasn't ancient history. The final chapter closed in your lifetime. What happened in Tuskegee wasn't a glitch. It was a decision, one made over and over again for 40 years, by people who looked the other way, by doctors who stopped being doctors, by systems that stopped seeing patients and started seeing numbers. The men of Tuskegee are gone now, their names barely remembered, their voices never recorded, but the silence they left behind is loud. It echoes in every missed appointment, in every side-eye at a syringe, in every question asked a little too late. That silence is what we inherited.